Part of the way we get there is a systems approach to medicine, which means we start looking at the whole elephant. We don't look at the parts, because those in power want us to look at the parts, okay? And when they look at the parts, they will always propose only one solution, which is quarantine, vaccinate. That's their solution to an immunocompromised citizenry. Quarantine, vaccinate. They don't want to talk about diet. They don't want to talk about food. They don't want to talk about supplements. They don't want to talk about clean air, clean water, and clean food. So what is a systems approach to medicine? What that says, and where it evolved from, was when the Genome Project ended, that we realized that we don't have 100,000 genes, which is what we thought when we went into it. We only have around 20,000 genes. And when this discovery took place in 2003 is when I went back to MIT, and what we realized was we need to take a systems approach to biology. That means to start, if we want to understand the whole body, it's not just genes, because genes are not who we are. Genes are not the things that always cause disease, but it's an interaction of food and the environment. This gave rise to a field called systems biology. I went back to MIT in 2003 because one of the big challenges was, imagine if we could use the computer to model all the chemical reactions. Well, how do vitamins work in our body? What actually occurs in the body without killing animals, which is what the typical models. Can we understand the dynamics? And that goal was, could you actually mathematically model molecular reactions on the human cell on the computer, where you see the cell as a big interconnection of molecular reactions? And by the way, this is one of these molecular pathways, and these are becoming converted to models. And if we could do this, that means we could use a computer to really understand phenomenon without shooting in the dark. Remember what I said, pharma companies, guy finds out something, they raise $40 million, do test tube testing, kill a bunch of animals. It's literally shooting in the dark. This says, can we move into the future and to take a much more powerful approach? So that's what resulted in my latest invention, Cytosolve, as big as email or bigger, I'm hoping, where we could really take the cell, understand it as an individual collection of molecular pathways, and use the computer to really solve diseases. And this was one of the first papers I wrote. And what this allows us to do is, because a current pharma model is a failed model. This is like a locomotive moving to its own death. And in fact, that's where it's moving. The pharmaceutical companies are moving to their own death because they're living in the medieval world, just like Fauci. And what you see here is that this new approach is really the future, where we look at the old research, we mine it, we build a systems level understanding of a disease so we can test compounds. And that's where this technology comes in. And it's as revolutionary as technology that was created when we built airplanes. We didn't simply throw a pilot in to kill them. We actually understood what was going on the computer, and then we went and built airplanes. And we've created this whole way of enabling truth, freedom, and health by really building what we call a collaborative way to do science. So when I'm going to share with you this vitamin D work, we have the ability to look at the richness of papers that have been written, mine them, organize them. So we're not just looking at one little paper. And with this capability, we have the ability to look at all the papers, mine those papers, understand the mechanisms, and come to a much more of a holistic conclusion. A quick example of the fun use of this. Here's when I grew up in India, people used to mix these medicines to understand what was going in your body. Well, if you asked them how you did it, it was a lot of hand waving. But with this technology, some of you may know curcumin, which is the active ingredient in turmeric, reduces inflammation. So here we have mined nearly many thousands of papers to understand all the way curcumin, which is the active ingredient in curry. Curry's, by the way, that yellow stuff that's in the curry powder, how that interacts at the molecular level, and we can mathematically model it. Similarly, what happens when you take resveratrol. And what we're able to do with this technology is really combine them and see what happens on the computer before you go hurt animals. So the far right column here, we're looking at, just look at these numbers, 0.15, 0.05, 0.06, 0.03. In the first case, no curcumin, no resveratrol. I'm using the computer. I have inflammation. That number 0.15 represents high inflammation. Next case, I reduce. I just give curcumin. And you notice this 0.15 goes to 0.05, which means I reduce inflammation. I just give resveratrol alone. And you notice it goes down from 0.15 to 0.06. And here I'm doing a combination. But look, 40% less curcumin, 60% less resveratrol, and look at the inflammation goes down even further, what you see here. So we're able to use this technology to really understand combinations. So there you go. So their approach, if you really look at over the last 40 years, what is the state of health in the United States? So I want to take a quick break and really talk about their model has been pharmaceuticals, pharmaceuticals, pharmaceuticals. Pharmaceuticals, 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 vaccination, 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 invasive surgeries. Very little is ever discussed. And frankly, doctors don't learn really how the immune system works. And this is not their fault. A lot of good doctors out there, if you're listening. It is the entire medical education model, which really is pharmaceutical-based medicine. And what you really have is that the doctors really don't learn nutrition. They don't. It's not really taught in medical school. It's not front and center. Remember, Hippocrates, the father of medicine, said food is medicine. So what you see here is let's look at the data. What have they delivered? What has people like Fauci delivered to us? The United States has the highest infant mortality rate. Highest infant mortality rate. Take that one statistic. These are actual data. Second, we have the lowest, by the way, this is in the developed nations, to be clear, in the Western world, we have the highest infant mortality rate. We have the lowest longevity rate. Okay? This is what the medical establishment has delivered. The lowest longevity rate. And this is how they've delivered it. The highest in US healthcare spending out of all the Western countries. 16%, 17% of our national economy is going to healthcare, and this is what they've delivered. The lowest longevity rate, the lowest infant mortality. And it even gets worse. This is what's happening relative to obesity. You know, people actually, what's unfortunate is we have a delusion taking place that before at least people knew that, had a sense that they were overweight. Now we have from 48% to 36% people think they're not overweight, when in fact, people who are overweight and obese has gone from 56% to 70% in this country. 30% are severely obese. When you look at obesity in the United States and diabetes, you see that we're spending about $327 billion. Diabetes rates are skyrocketing. We're 15% of the US population will be diabetic. Today, we have around 34 million people. At this rate, we're going to hit 45 million people. And by the way, this is also a global trend. We're looking at 700 million people globally. The next thing is you also notice depression among our youth is rising. It's almost doubling from what it was in 2008. Nearly 16, a doubling of that number of people in the age of 18 to 25 and 12 to 17 years old are feeling depressed. The next set of statistics really speaks to what is going on with medical interventions. So we are told, go to hospitals, take pharmaceutical drugs. The average 82-year-old is on 12 different drugs. What do we see here? Well, we see that the third leading cause of death in the United States, nearly 440,000 per year, the third leading cause of death behind heart disease and cancer is medical errors in the hospital. That's what we see. Third leading cause of death is 440,000 deaths per year from medical errors. Now, if you combine this with this next data, which is prescription drugs, fourth leading cause of death. Okay, and what you see here, this number is actually wrong. It's about 180. It's actually about 100. It's about 128,000. But regardless, what you see here, this is a paper that just came out. Prescription drugs kill us in large numbers. And this is what it says. Few know that systematic reviews of hospital charts have found that even properly prescribed drugs, aside from misprescribing, overdosing, cause about 1.9 million hospitalizations a year. Another 840,000 hospitalized patients are given drugs that cause serious adverse reactions for a total of 2.74 million adverse reactions and about 128,000 deaths. This is from Harvard University. Few people know that new prescription drugs have 1 in 5 chance of causing serious reactions. The reason I wanted to bring this up as I lead into the vitamin D stuff is that people are asking, oh my God, can I overdose? Can I overdose? Yes, you have to be careful. However, the risk there is so low compared to what we're talking about prescription drugs. And the medical establishment, part of their fear mongering is to really highlight that. And we'll come back to that. but I wanted to share this with you to really give you the state of the modern medical establishment. It's not that great. They don't have a lot to really ride on. So if you really look at the healthcare errors, then it's really the #1 cause of death. If you look at medical errors plus prescription drugs, we're at least at 620,000 deaths, 1.9 million hospitalizations, heart disease is 590,000, cancer is 574,000. So just think about that. 17% of our GDP goes into this medical establishment, and they're delivering medical errors and prescription drug failures, and 1.9 million people get hospitalized. I don't see Fauci talking about this as a medical emergency. All right, so let's now talk about, just to wrap this up, this is coronavirus, this is a regular flu, and we've just gone over the statistics of the devastating way in which the medical establishment is hurting our health. So let's go to vitamin D. If you remember, we reviewed last time that the model of the immune system that was used to develop vaccines was just a 2-compartment model, which involved the innate immune system and the adaptive